must be worried about a JR exam, JR interview, and you must be worried that what question they will ask you. But nothing to worry about that, because they just ask you the normal questions just from the basic. They'll not ask you, they'll not go into the deep of any subject or any topic. So I'm just sharing my experience. So when I go to Palika Hospital, it's a government hospital, as you know, it's of municipal corporation. So that's why when I was there for the JR interview, they asked me that. First of all, they asked me what I'm doing right now. So I said that I'm working in a clinic right now. So they asked me what you are doing there. So I said that I'm doing extractions, I'm doing capping, I'm doing restorations, I'm doing RCT. So she asked me that what RCT you are doing there. Means in permanent or primary tooth. So I explained that I hadn't done primary, I'm doing in a permanent tooth. So then she said that what files we are using, what's the procedure of the RCT. I said that access opening, BMP and the obturation. Then they asked me that which files are you using in BMP. Then I explained. After that, she asked me that why do what's the need of the BMP, why we are doing the BMP procedure in the RCT. So I told them just to shape and to clean the canal. So then she asked about that, that is something missing, is anything there which we are doing in the BMP procedure. Then I was just explaining again and again about the BMP procedure, but then she just want to listen her answer. And then she told me that is anything eliminated from there. Then I just it just clicked on my mind that yes, removal of the smear layer. So we are just doing for that purpose only the RCT. Then she asked me, okay. Then she asked me if you'll get the chance to get admission in your PG, so which department will you choose? So I said that oral surgery, of course, and if it's not, then I'll go to the um, pediatric dentistry. So after that, she asked me, okay, so you love kids, you love pediatric dentistry, then explain what's apexogenesis, what's apexification, which materials we use in the apexification and the apexogenesis, what's the difference between them. And then after the eruption sequence, when the root completion occurs, and at what age. So everything they just asked me about that. And it's just normal questions, actually, you can say. And from with my friends also, they were who appeared in the interview. So they were asked some questions just like what's the landmark of the inferior nerve block, what's the landmark of the posterior superior nerve block, and which finish line will you use in the PFM crowns. Okay. And they were just asking like this only. Okay. So, and there were many more questions, but it's normal, I just want to say. And somewhere in some interviews, they also ask the incisal liability, primate space, and leeway space. What what do you mean by the overjet overbite? So these things, the malocclusion, or classification of malocclusion, and after that the treatment, correction of the malocclusion, self-correcting anomalies. So these are few things which you can study, just a basic of all subject. Okay. And nothing other than this. So all the best for your future, all the best for your interviews, and let's see what happens to me. I'll tell you that what happened after my result. But as I know, they were saying that they were asking for just like they were asking me, is anyone working here of your blood relation, who's from your blood relation, is anyone working here in in our NMC. So I just said no, no one. So I really don't know about that what will happen to me. Maybe I'll got selected, or maybe I'll not, but still I'll try again and again for that. And I'll just I'll just convey one message to you, that please appear in the exam and just try at once, so that you'll not have guilt anymore after 2 years or 3 years that you hadn't appeared in the exam. So that's why I want to say these things. Hope this video will be helpful for you. If this will be helpful for you, then please like, share and comment. Thanks so much.